Transparency in IVF, empowering patients with informed choices. In our clinic, Dr. Anjali Malpani and Dr. Aniruddha Malpani emphasize open discussions about various IVF treatment options in front of our patients. IVF is a complex field lacking clear-cut solutions, so it's crucial for patients to comprehend the available choices and the rationale behind our recommendations. Patients find relief in witnessing our transparent discussions, understanding that we've thoroughly considered options and arrived at a well-informed conclusion. Contrary to concerns that discussing alternatives might confuse patients, we found that patients appreciate the comprehensive approach. They acknowledge medical uncertainties and value our detailed discussions on risks and uncertainties, enabling them to make informed decisions without bias. Patient involvement is crucial to us. We encourage them to express preferences, incorporating these into our decision-making process. However, we clarify that despite numerous theoretical choices, practical applicability in real-life scenarios may be limited. Consider situations where a patient gets a poor-quality embryo despite a high-quality lab. While a split test might seem logical scientifically, it's not feasible in human IVF clinics due to ethical constraints. We openly discuss the limitations of our IVF knowledge, avoiding oversimplification of facts. Real-life constraints restrict the choices we offer. Thus, we provide a cooling-off period, allowing patients ample time to decide what aligns with their values. In contrast to paternalistic approaches, we believe in patient autonomy. IVF being elective, patients should lead decision-making. We act as facilitators, sharing knowledge and inviting patient input for a patient-centric approach to IVF. For guidance on your fertility journey, visit our website for a free second opinion or contact us on WhatsApp at 9867441589.